Yeah. So pretty much where would we start with something like that as far as history and physical and trying to work up someone to evaluate whether or not this may possibly be a OCD lesion?
Yeah, so you touched on some of them, the duration. Some of the big things that are important are is it activity related or is it all the time? So does it only happen when he runs, or is the pain starting to occur every single day, every time he takes a step or every time he walks? Has he ever had issues with this before? Did he have issues with this when he was younger? Did it just start within these last few months, and has it come on and has it worsened over that time? Are important types of history. Does he have any type of family history of any sort of congenital issues or any sort of any family history of any other type of arthritic issues or cartilage type of issues within the family themselves? And then certainly from the physical exam standpoint, big things are joint effusions, especially at that age. Anytime an adolescent, you want to know if they have a joint effusion, because if they're having recurrent joint effusions, then something's happening intra-articularly and something's going on that should tip you off, if they're having recurrent joint effusions. And then from the specific physical exam standpoint itself, you know, where's the pain? Where's it located? When does he get it? Does he have any evidence of any sort of catching or locking or crepitus within the joint with range of motion? And then, is there any sort of tenderness to palpation? And it depends on the joint that you're talking about. This is a football player, you said, in the knee, correct?
Yes, sir.
Yeah. So a lot of times they'll have pain, tenderness to palpation, over one condyle or another with deep flexion, especially if it is an OCD and if it is located on one of the condyles, which is what's most common in this age group or that age group for an OCD. So you'll do your kind of typical range of motion and ligamentous exam, but sometimes when you put them into deep flexion and you palpate one condyle or another, they'll be focally point tender over a certain condyle, and that'll kind of clue you in that they may have a localized defect or a localized lesion on one condyle or another.